Common question that's asked is, after an injury, how do you go back into the gym and work out? One of the things that I suggest is, number one, to go back into gradually. Start off with more isolated exercises. So using a machine is a little bit better than using a dumbbell, which is better than doing a free, instability exercise. So start off really stable. And if you're going pretty slowly, you can actually see if it's bothering you before you actually re-injure it. So you start off really in isolation, slow repetitions, lighter weights. So, if it's really, really injured, this gets all thrown out the window and you just got to wait for it to heal, just try to move it. But movement is good after an injury, it has to be very gradual, progressive, very isolated, very slow. Along with your, getting treated and actually fixing the problem, along with maybe some modalities to help keep it loose. Doing the right things, like it used to be RICE, where it used to be rest, ice, compression, elevation. Now it's a little more ice. So that rest component of RICE is kind of out. You want to move it, but the good idea to, if you're not sure, ask your physical therapist, ask your doctor what you should be doing, how much movement activity you should be doing. But start small and then build back up.